Good afternoon, everyone. Welcome and thank you for joining our webinar this afternoon, Diabetes and its Effects on Health. I am Gina Gray. I'm the General Manager here at Bioregeneration Integrated Medical Center, which is a regenerative medical practice led by Dr. Janice Fisher, our CEO, Clinical Director, and Regenerative and Anti-Aging Consultant. Dr. Fisher is a graduate of University of the West Indies Mona School of Medicine and also holds a Doctor of Natural Medicine degree from the Pan American University in Plant-Based Therapeutics. She has been practicing for over 20 years, and the cutting edge and innovative therapies administered here at Bioregeneration employs protocols that have been developed by her with a focus on regenerative medicine and overall wellness and longevity. As I hand over to Dr. Fisher to take us through, please hold your questions until after, or you may drop them as you think of them as she's doing her presentation in the chat, and we'll be sure to respond to them at the end. Thank you. Dr. Fisher, over to you. Dr. Fisher?
Sorry, I was not muted.
Yes.
All right.
Okay.
Thank you, Gina, for that lovely introduction. And thank you, everyone, for joining us during your lunch break. We know how treasured that time is for you. And I'm really excited to talk this evening on diabetes because I really believe it's going to be pivotal and a number of the nuggets that we'll be able to share. So without further ado, let's jump in. So our Center Bioregeneration Integrated has been practicing integrative and regenerative medicine for over 20 years. And we're pioneers in IV vitamin treatments, medical weight loss, integrative chronic disease supports, and of course, regenerative medicine for repair using stem cell platelets and exosomes. And part of our mission really is to provide the products, the services, and training, like what we're doing today, to help everyone live healthier and longer lives. So we're going to look at diabetes from a root cause care perspective and look at some of the additional tools that can be really used to move the needle to reduce complications and to reverse some of those complications. And so, as you all are fully aware, diabetes is attended with a lot of complications in the eyes, including blindness, obesity, erectile dysfunction in men, heart disease, kidney failure, and nerve damage. So it is one of those diseases that really can damage quality of life, not just your longevity. And the story of diabetes really surrounds insulin and insulin resistance. So when we eat any carbohydrate or starchy food, that will be digested down to glucose, and glucose will cross the gut into the bloodstream. And insulin is like a bus. It's going to take that glucose from the bloodstream to the cells, where the cells will use the glucose to make energy. In insulin resistance, it's almost like insulin is not able to interact with its receptors. So it's almost like it's ringing the doorbell for the cell, but the cell is not hearing it on the inside. So what happens is that we have this increase in glucose in the blood, whereas inside the cells, they are starved of energy. So insulin resistance is this impaired ability of the muscle, the fat, and the liver to take up their glucose in the presence of insulin. And there are a number of reasons why we get insulin resistance. Some genetics, things run in the family. Sometimes the diet is excessive in calories, and sometimes the diet is very inflammatory. And even just not moving. The body needs the movement, it needs the stretching, and just the diet, the exercise, the inflammation. There are lots of medications that can also push us in that direction. But the culmination of the factors, of a number of lifestyle factors, is this insulin resistance. And it's the insulin receptors on the cell that no longer respond to insulin. So the end result of, or one of the end results of insulin resistance is diabetes. So it starts with insulin resistance, or the cells not recognizing insulin. In response to that, the body just pours out a ton of insulin. And this excessive insulin tells your body to store fat because we're not utilizing glucose well. It also creates a very inflammatory situation that damages the arteries. And because we have this impaired glucose disposal or impaired sensing of glucose, it leads to fatty liver and eventually to type 2 diabetes. But impaired nutrient sensing is not just a diabetes problem. And that's why if we're able to tackle it and reverse it, or at least manage it sensibly, we can change a myriad of health conditions. Impaired nutrient sensing is associated with heart disease, high blood pressure, everything we call sickness, fatty liver, obesity, nerve degeneration. And if we look at it, the top three causes of death, which are cardiovascular, neurodegenerative, and cancer, has metabolism at its core. So if we're able to really dismantle this metabolic dysregulation, we're able to really reduce the top three causes of death, and that is huge. So why we want to focus on metabolism and really just fixing metabolic dysregulation, the numbers speak for themselves. So when you're diabetic, you quadruple your risk of heart disease. You double the risk of certain cancers. And we're already living in an environment with a lot of chemicals. We don't need to double the risk. And there is almost a 70% higher risk of developing dementia. And just being overweight alone is not, just being obese alone is not a state that we can say we can leave you in. It's not health because the risk of heart disease doubles in obesity. And there is a 7 times higher risk of certain cancers. And I really have to really say this with great sort of somber because this is something we see day to day and we battle day to day. And there is a 40% higher risk of dementia. So if we're able to fix metabolism, we can impact health and longevity exponentially. There are at least 13 cancers that are associated with being overweight and obese. So we really increase the risk of these top three causes of death. And when you look at the plethora of what we call high insulin states, we're not just looking at diabetes or pre-diabetes. We look at high blood pressure and cholesterol, and this triad of sugar and pressure and cholesterol is really metabolic syndrome. It's really a high insulin disorder. Polycystic ovaries in women is also a high insulin state. Most cases of obesity, and we have heart disease and brain disease and accelerated aging. So if we're able to tackle insulin resistance, we're able to do quite a lot of good. So again, insulin signals muscle fat and liver to take up glucose for its use as an energy fuel. And insulin resistance is the impaired ability to do so. And there's a progression from insulin resistance to type 2 diabetes. And so as we look at optimizing care in type 2 diabetes, we have to say that there is great benefit to reducing not just the blood sugar, but reducing weight and to creating a diet that is holistic. So what we're really talking about is the implications of weight loss and body composition on your metabolism, health span, and your longevity. Because at Bioregeneration, our vision is really to be the world leader in optimizing health and longevity. So it's at the heart of everything we do. And so this is why we really focus so much on insulin resistance. Insulin resistance leads to diabetes, and diabetes leads to glycation. Glycation is just sugar bonding to the proteins and fats in the body. So when you have this excess of glucose in the bloodstream, it's going to bind to your white cells, so you can't fight infection, bind to the nerve, creating all sorts of numbness, tingling, and it's going to bind to any protein or any fat that is around. So almost the entire body will go through this glycation process. And the thing about glycation is that it narrows the blood vessels when there's excessive glycation in there. So diabetes is particularly vicious at blocking the blood flow. And it's going to, include your vital organs, the brain, your heart, the penis. Diabetics are 3 times more common to have erectile dysfunction. It can cause kidney failure. A lot of diabetics end up on dialysis. And of course, the poor circulation in the feet to the point that sometimes we have amputations in so many of our diabetics. And so we know the glycation is going to damage the blood flow, it's going to damage the nerve, it's going to damage the immune system. And the immune system damages infection, and it's what predisposes to the higher risk of certain cancers. And really and truly, that could have been enough. But to add insult to injury, diabetes, the sugar also binds to enzymes, and it binds to enzymes that make nitric oxide. And nitric oxide controls and regulates blood flow and oxygen delivery to every cell in our body. So if you're not able to optimize blood flow and you're already narrowing the passage for which the red cells have to traverse the vessels, and then you're not able to effectively open blood vessels, you're not effectively able to deliver oxygen, then this is really a difficult situation. So, loss of nitric oxide leads to elevated blood pressure, and so a lot of diabetics will become hypertensive. It also leads to erectile dysfunction, in addition to the fact that the blood flow is already being compromised. And of course, this is going to increase risk of heart attack and stroke. And diet and exercise are not sufficient most times in restoring nitric oxide. We need strategies to test that. We need strategies to really optimize that. And that's one of the pearls that I really want to kind of drill down today in terms of diabetes care. And finally, the body does attempt to get rid of this excess glucose that's building up in the blood. And how it does that is by increasing glucose excretion in the urine. So one of the early symptoms of diabetes is that you have frequency of urine, and to the point that you'll get dehydrated and get you get excess thirst, you get fatigue, you get frequency of urine. But in this urine is not just glucose; is almost what would you say, most of your vitamins and minerals, and some key ones like zinc and magnesium that you need just for daily health will be lost in the urine daily in a diabetic. And this is really an important factor that we can use. Loss of a lot of these water soluble nutrients also cause damage. So we have to be paying attention to all of these areas in the diabetes care. So I want to throw out a few questions and hopefully I can get some responses. So how many drugs do you think we have on the market for diabetes? Anybody? You can unmute.
Metformin.
All right. Well, how many total drugs for diabetes? 10, 20, 500?
Maybe like 1,000. I don't know.
Well, I think it's about 60, about somewhere between 60 and 80, because, there may be 60 in the US and there may be 70 elsewhere. Like we have been using metformin before it was even approved by the FDA, because we came through the British Pharmacopoeia and they have had it before the US. So the idea is that we have a lot of drugs for diabetes. But how many of those drugs do you think improve insulin sensitivity, which is the heart and soul of diabetes? It's less than two. So it's at least about two now that we have the GLP-1s. But absolutely none of them address the nutrient deficiencies of diabetes. So it is part of the care that we offer to make sure that you're on something that will bring down that sugar. And bringing down the sugar is life-saving. We already understand that elevated sugar can put you in a coma, it can do a lot of damage. And just bringing down the sugar is important, but it's not enough. And I do think that we have enough information now to add to that. So let's talk a little bit about that. Now, this is obviously a major concern for most. What would you say? Most countries are buckling under their healthcare crisis. Health is one of the most important concerns of our time, and long before even COVID came. And it's an individual responsibility for us as a nation, as people, to really promote good health, and it doesn't have to be difficult. We're trying to demystify all of this. So when we look at combined overweight and obesity in Jamaica, it affects 70% of women and 40% of men. And so we have to look at these sustainable solutions and lifestyle practices to not be in that statistic. So diabetes does affect 1 in 6 Jamaicans, And if we included pre-diabetes, we're probably up down to 1 in 3. It's really, really quite common. And so one of the things that I want to put forward, and it's one of the things, we'll be looking at the GLP-1 agonist. And GLP stands for glucagon-like peptide. And it is really particularly effective at correcting these hormonal disruptions that I spoke about to improve the body's nutrient sensing and improve metabolic efficiency, namely insulin resistance, leptin resistant, and ghrelin resistance. And these are all affected in diabetes. So now what I want you to remember is that the GLP-1 is a hormone that's naturally produced in our bodies. So it is secreted by the intestinal lining. And so we're all making it in response to a glucose load. And it's the natural way with which the body assists insulin with glucose disposal. Now, the medications that we have available are a synthetic version of what our bodies made. And they have been modified, so they're patented, to extend their lifespan. And it's this extension of lifespan, keeping them around longer, that allows us to manipulate them to do some good in the body. And so what I want to talk to about, and I'm going to kind of show you the benefits of it across all the systems that diabetes really ravishes. So we know that it helps the pancreas. So we know that it helps it's FDA approved for diabetes, it's FDA approved for weight loss. So those are established. But if we look at where the receptors for GLP-1s are, they're all over the cardiovascular system. They're in our central nervous system. They're in the gut, kidney, liver, nervous system, bone, and immune system. So these particular class of medications have a special role to play in diabetes. And because they also help weight loss, and a lot of the medications outside of metformin can cause you to put on weight. And then that makes the diabetes worse. And then you're in this loop of that you really can't escape. So the GLP-1 agonists help to slow down degeneration of the brain. And we know that's in the top 3 causes of death. But they're also anti-aging because it helps every single cell in the body that secretes proteins to do so more effectively. And so here we have a treatment that can look at both weight loss and diabetes. And when you lose weight, you need less medication. And sometimes your diabetes goes. And so it's synergistically acting to bring you to a place where you can actually reverse the diabetes in some situations. But we offer a comprehensive look at it based on all the things that we know. So we're going to put in IV cocktails to replenish those nutrients that are lost. And we're going to not just be looking at the scale, because we have advanced medical equipment that we can do metabolic breath analysis and we can look at your metabolic rate. We want to make sure that you are getting healthier. We're going to look at your body composition because we want fat loss, never muscle loss. And we want to make sure that we improve muscle, we maintain metabolism, and reduce something called visceral fat. So it's going to be personalized exercise and cardiovascular optimization. And of course, we have to look at your nutrition, because if we look at nutrition, stress, sleep, and inflammation, and we manage those, then we can reverse a lot of the insulin resistance. And if the insulin resistance is reversed, then you're able to maintain your effects without the need for medications long term. So the broad clinical applications of the GLP-1s is something that I'm just excited to share. So I'm just going to go through really quickly. In the cardiovascular system, it improves the elasticity of the blood vessels, it reduces blood pressure, reduces cholesterol. In the kidney, it preserves the filtration rate, it reduces protein loss. In fact, I've had patients who came on for weight loss and diabetes control who were already in renal impairment and whose renal impairment went away, and so they have normal kidney function now, just from the GLP-1. In the liver, it reduces fatty liver, it reduces inflammation in the brain. There is dementia risk that is being reduced, and of course, improving synaptic plasticity or connections. For PCOS patients, we have improved insulin sensitivity, we're improving fertility, reducing those androgens that are causing the acne and the excess hair growth, and normalizing cycles. Endometriosis, we're seeing benefit. For male infertility, we're having better testosterone, better sperm motility. There is benefit for skin conditions. In fact, the GLP-1s are anti-atrophy, so they should be preserving muscle. Now, there are patients who lose weight on the GLP-1 and who also lose muscle mass. And that's not an impact of the GLP-1s. It's really dependent on your protein intake, your water intake, how much movement, and how fast you're losing the weight. So it has to be monitored, it has to be measured to preserve muscle mass. But these drugs also improve your bone density, your skin collagen and elasticity. And it is because of that a lot of patients just look so much younger when they go on a GLP-1. And in the eyes, we're decreasing diabetic retinopathy, we're reducing glaucoma. So these one medications have a plethora of effects. But I told you, the medication is just one of the tools. And the medication helps us to do right by you, because doing right by you means helping you with diet and exercise, because those are the body's original methods of preventing insulin resistance. So we're going to dive in a little bit on diet and exercise. And this chart is just to say that exercise influences nutrient sensing. So just by stretching the muscle, you're improving insulin resistance. And the particular area of exercise that we like to teach you is zone 2. And zone 2 is not a very high intensity exercise. Most people can do it. It is the best. There are 6 exercise zones. And we can do a metabolic breath analysis and tell you where your zone 2 is. And zone 2 is where you burn fat. Zone 2 is where you improve your metabolic efficiency and your mitochondrial function. Zone 2 is where you improve insulin resistance. And my zone 2 might be 98 and Gina's maybe 120. And so if you're exercising and doing, your movement and you're outside of zone 2, you may be achieving other cardiovascular benefits, but you may not be burning fat. And so you may be just emptying your glycogen stores. And then when you go and eat a shake, you replenish your glycogen stores. You empty your glycogen stores, which is just burning glucose and eliminating water. But the amount of fat remains. And so we can give you a very precision-based formula to really optimize. And a lot of times doing zone 2 is at a pace that you can carry on a conversation. And so that is a bit about exercise. Now we have to talk about diet. And of course, calorie restriction. There is no weight loss without calorie restriction. And one of the things that we like to do is intermittent fasting, because diet can improve in nutrient sensing. And so the better dense the diet is with nutrients, but also periods of not eating to kind of cycle the body through nutrition and cleaning will help. And the purpose of this slide is to show you that one of the best proven methods of anti-aging is eating less, but also we're going to improve health span. So your lifespan could be 80 years and your health span is 40, because at 40 you get pressure or sugar or pre-diabetes. So once there is a disease, that's where the health span ended. But really and truly, as you eat differently, you're going to find the insulin resistance improving on its own. And so one factor to drive home is that skeletal muscle is an independent predictor of mortality. Mortality is death. So in the world of anti-aging, we say more muscle is the currency of anti-aging. The more muscle you have, the longer we expect you to live and the better we expect you to live. So we do everything to preserve muscle, and you cannot manage what you cannot measure. So you must measure muscle and you must optimize muscle mass. So our patients look and feel good. This patient lost 70 pounds. We've had so many patients who have gone through our program who have not only lost fat but optimized their muscle mass and optimized their metabolism. And so when they come off, their PCOS symptoms are not as bad. They get better periods and that sort of thing. And it really comes down to the pace of weight loss, guided weight loss. This is our in-body scan that we use as a medical device that's FDA approved, and it is used to measure percentage muscle and fat. So if you lose 5 pounds, we can tell if it's fat, water, or muscle. We must be able to do that. And this is our Pinoy device that we use to measure your zone 2 heart rate, your VO2 max, your biological age, and really your body's metabolic rate. It's a direct measurement. And so we want to maintain healthy metabolism. And this is just an example of one of our reports. So we can look at the bottom. At the very bottom, we can see the weight moving down. We can see muscle mass going up. We can see percentage body fat moving down, and we can watch water and visceral fat. So we have a lot of precision around what we're doing. And so I want to leave you with a few pearls now. And I would say the single most I would say successful strategy around diet is just removing ultra processed foods. 80% of your diet being whole foods. And it simplifies decision making, it reduces obsessing over calories, and it provides great satiety because when you have nutrients, you have less cravings. A lot of your cravings are because the body wants some zinc or magnesium. Don't feel for a burger, it feels for nutrients. It's run on nutrients. Without nutrients, you know,
Doc, you're frozen a moment.
it all right. Am I back?
You are back.
And everyone hearing me just fine?
Yes,
I can
hear you
hear
now, Doc.
Perfect.
But your
And are you seeing the
presentation is
presentation?
gone. No, it's
Great.
gone.
It's gone. All right. Let me stop sharing and reshare. Sometimes we like this with the internet. Is the presentation back for you?
Yes, it is, Doc.
All right, so it's just some simple pearls, removing ultra processed food and eating your goal body weight in grams of protein. And the key is consistency, not intensity. I also, in the world of exercise, want to just give you one or two things because, as we say, we're using a holistic approach and we really have to look at long term sustainable measures to reduce the insulin resistance long term. And that's going to be key to not just controlling diabetes and weight loss and all of these high insulin states, but to maintain. So strength training is what we would say would be the best exercise um, for improving the insulin resistance. And I say you get 70% of the benefit by doing it 1 day a week. Sprata. And it could be deadlift. Improve insulin sensitivity, the wellness benefits in balancing hormones too. And so we want you to do at least twice a week some strength movement, just for 20 minutes. If you can do 30 to 60 minutes, even better. And so the foundation is that it's not just about muscle, it's about longevity. Remember that muscle is a currency of longevity. So in a body composition framework, we want to look at reducing fat, improving muscle, and reducing visceral fat. Visceral fat is in the organs. We also want to improve your cardiovascular risk factors, your cholesterol, your blood pressure, improve your metabolic risk, so your fasting insulin levels, your A1C, your fasting glucose levels as well, improve exercise training, your zone to exercise, your strength training, improve your eating habits, so long term we can maintain, improve gut inflammation, sleep, and stress management. So we have at least 4 GLP-1s available. It really is that, we can navigate the space to reduce any issues. And there is usually one that will agree nicely with you. And it corrects the disruptions. Now, I've highlighted the last impact of the GLP-1s, the fact that it slows down gastric emptying, because this impact of it can lead to some side effects. And most of these side effects can be managed by a physician with just tweaking how you eat and then just gradually improving the rate at which we increase the drug. So you could have constipation or diarrhea, there could be nausea or fatigue or indigestion. The idea behind it is that it is a drug and it is not over the counter and it needs to be managed. And when managed, it has more benefits than side effects. Most patients, I would say 99% of the time, we don't have any side effects. But there can be side effects when you start or when you increase the dose. And to leave you, I think it really is looking at this idea of wellness, and we have to look at diet and activity and hydration. It's like a wheel and it's not held up by one activity. So we have to correct the nutrition. It does involve a consult. We must, look at it, and it is for everybody. And so the treatment strategies that I want you to take home are that we have to work on insulin resistance. And you see that glycation, the bonding of sugar to protein, we can reduce it with carnosine. We can optimize the nitric oxide. We can test it. We can optimize it where it's low or depleted. And we can restore the nutrients. We can do IV vitamins and get them in. We can fix the gut and improve nutrients absorption. And the key is to be consistent and to monitor. And that's the presentation that I had prepared for you today. Thank you for your time. I really appreciate your attention. I'm going to hand back over to Gina. You're welcome, Gina. Let me mute.
Here, what we got to, and actually now we are going to invite Miss Morgan. She's actually from who I'd like to invite her now to share her journey. Ms. Gordon,
Right,
over
thank
to
you. Okay, thank you. Good afternoon, everyone. I'm not sure if you're hearing me clearly. I'm having a little difficulty with my connection. Can you hear me?
Hearing you so far.
Yeah.
Okay, good.
Yes.
All right. So, I was just paying attention to the presentation earlier, and I was looking at some of the symptoms that Dr. Simmons was mentioning. I'm like, that sounds so much like what I was going through before I started this particular treatment. It was crazy, and I didn't realize that so many things are attached to diabetes, pre-diabetes. I didn't realize there were so many symptoms and things that are impacted by the sugar levels and so on. And I'm realizing now the far-reaching effects of the treatment, because the fact is a lot of those symptoms that I had have been cleared up. It's so surprising to me. I know definitely that yes, the diabetes would be controlled, the hypertension would be controlled, yes, but the additional benefits that I'm seeing, because I've been trying for a bit to try and sort myself out, try to improve my health and everything, but the things I was trying before, they weren't working. And of course, having, interacted with Dr. Fisher and our team for a while, I'm realizing now how very impactful or helpful this treatment is, the volume of, improvement I'm seeing, and it's just a relatively short time as well. So I do see where, it's beneficial, and I'm hoping, I know for a fact that the improvements will continue. And I'll just, keep you guys posted and let you know how well it goes going forward.
All right. Thank you so much for sharing. I really appreciate you doing that. Okay,
You're
so
welcome.
so now there are no questions in the chat, but feel free to unmute yourself if you have any questions for Dr. Fisher.
Hello, good afternoon.
Good afternoon.
Yes, one good question. Um, Not being a diabetic, but was listening to a podcast and the person had mentioned about a part of person sickness apart from the gut issue. You might have dental issue. You also make mention of insulin, which sometimes doctors does not check. Doc, can you explain that to me more in terms of somebody who is not diabetic, but then why are not our insulin is not checked at the time when you visit the doctor? I don't know if that's the understanding of the question. You hear me?
You're still muted, Doc.
Thank you. Thank you for the question too. So we would normally look at, let's say, A1C as a proxy for the actual insulin levels. And for a while, we had to send overseas. It's available now. And I would usually check the fasting insulin, not just the fasting glucose. Because by the time the sugars have changed, you've had elevating at insulin. Frozen again? Such internet. I'm going to turn off the video. Yeah. So, are you hearing me?
Yep, we're hearing loud and clear. I'm hearing.
Are you hearing? Right.
Yes,
So,
Doc.
as a proxy, we can do a clinical examination and we can see features of high insulin. We can see features, in the skin. We can see features in blood, in weight, and so on. So, there is the acanthosis nigrans in the neck and under the arms and on the folds. But if your doctor doesn't necessarily check insulin levels themselves, then there are several proxies for looking at it. But we are looking at insulin levels now.
Okay, good. I was saying it's not insulin.
But remember, the A1C is standard to most executive profile. So when you do the A1C, it looks at your insulin resistance scores too. And so we can look at the A1C and the fasting insulin and calculate your insulin, or what we call insulin resistance scores.
Okay, then.
It's something that we interpret from the executive profile.
Thank you, Doc. And thank you for the question as well.
Okay, good.
Anyone has any other questions that they'd like to ask?
I do.
Go ahead.
Good afternoon, everyone, and good afternoon, Dr. Thank you for your presentation. I have a great question. So, can somebody diabetic even though when they do the necessary tests, it's not really showing, but then you find that the person is having like hypoglycemic episodes. I heard you made mention about the executive profile. They did so they did the fasting insulin. That's well. But they're still having hypoglycemic episodes. There's also weight gain, not having the polyuria, polydipsia, polyphagia, and in addition to that, there is like some level of fatigue and wanting to sleep all day.
This is a very, very specific situation. And the focus today will be, and my answer, I just want to kind of give you the disclaimer that it's really for educational purposes. And in a specific situation, you want to look at the details of that case with your physician. And so you can be diabetic and you have normal values, so to speak, of A1C, fasting sugar, 2-hour sugar. and we call that diabetes controlled on diet. Or it could just not be diabetes yet, and you're having excess insulin and you're having hypoglycemic episodes. Or you can have a myriad of other things that maybe have, what would you say, have pulse releases of insulin that can drop the sugar and appropriate secretion. And so the idea is that it's hard to say whether it's diabetes or not without looking at the values, without looking at the details, and in understanding if it's an appropriate or inappropriate secretion, or people have had hypoglycemic episodes, even in an insulin resistant state, before they reach a place of extended hyper or high sugar states. So it's important to look at the values of everything: the insulin, the sugars, the A1C, and see if they're on medication or no medication, and understand when the hypoglycemic episodes are taking place. Because you can have everything from something innocuous to something sinister. So the details of that needs to be really looked at to understand what is taking place, and to even try to do it without that detail would be difficult at the very least, and more than likely incorrect.
Understand. Thank you so much.
Yes, you're very welcome, Shanice.
Thank you for the question. Thank you, Dr. Fisher. I'm just dropping our telephone numbers in the chat in case anyone would like to reach out to schedule an appointment. Any other questions?
I have a question, Gina, probably a strange one. So here's a hypothetical patient whose figures are, going up. What sort of time scale would you expect to see a turnaround in the figures, their A1Cs, that kind of thing, on this strategy?
Right. I would say within 4 months. And you should find improvement. And sometimes it is normalized, and sometimes normalization takes 8 months or so. Most of the patients, I would say within 4 to 6 months. And the drugs are insulin is life-saving, right? But these, I would say, are one of the best sort of strategies for tackling diabetics. And I've had diabetics come in that we can't record it, it just says high. It means it's beyond the recording ability of the glucometer. And within a month, we're seeing control. And within 4 months, A1Cs are normalized. So it hardly fails with diabetes. You can have failures with weight loss more, but it really is tackling the underlying cause and a number of the complications at the same time. So remember, this one drug is looking at reducing sugar, pressure, cholesterol, arthritis, and aches and pains, in addition to weight. And when all of that is on board, the body prioritizes the sugar and the heart long before it even blinks at weight. So it's particularly useful because it's going after the insulin resistance for diabetics. And because you're usually getting weight loss, you're going to see even a more deeper control of the diabetes, because you have not just the insulin resistance, but you also have the weight loss adding to it. So I would say 4 to 6 months. And, Dr. Clark is on the call too, and she has so much experience with GLP-1s. She hosts our IG Live, and I think she could also chime in if she wishes to just say what is the usual time for her patients. But yes, I would say 4 to 6 months.
Okay.
Thanks, Judith, for the question.
Thank you. Thank you.
We have a question in the chat as well now. If you are diagnosed as diabetic, how often should you have it?
That's every day though, they we say we can't manage what we can't measure. So if you've gotten diagnosed and you have worked out a diet and a routine that your fastings are between 4 to 6 and your 2 hours are between 6 to 8, maybe you can check it twice a week. But in the early stages, you want to work out the kinks and you want to figure out how to eat and what moves the needle, because a lot of times just doing strength training brings down the sugar and coming off the foods, because a calorie, let's say from a processed food, 50 calories is not the same as 50 calories from banana. And so one is going to come in with inflammation and chemicals that's going to
Oh
drive
my gosh.
it's going to drive your sugar up. So you want to be measuring how your body responds to different meals. And some patients will say, oh, if I have 2 bananas, I'm good. If I have three, it goes up. But we really want you to have, some sort of glucose diary and some app monitoring. We have these wonderful 24-hour continuous monitors that you can put on the side of your arm, and it goes with the app, and at any time, 24 hours, you can look and see your glucose, and you can look at it over time and see if it's spiking. And you can say, oh, it spikes every time I have peanut porridge or whatever. So it's imperative that you monitor daily, but if not, at least twice a week. We want you to do your measurements, at our level with the A1C once or twice a year. And that depends on control again, because some diabetics are fairly well controlled. And, somebody alluded to the mouth and all of the gut issues, because most times when it is hard to control, there's an inflammatory situation going on. And a lot of times we forget that just gum disease. And, people have raging blood sugars, and we send them to have it sorted out, and the sugars come right down to normal. Sometimes they have gut inflammation and just little things. So it's really important to know what's going on in order to prevent the damage to the kidneys, the damage to the blood vessels, and so on. You really have to know. And just like, you're not going to the house without sometimes checking the mirror. You just don't want to walk around as a diabetic without knowing your numbers this week. You have to keep a track. And what works, there are some patients who do it 5 times a day and some who do it once a month. But I would say they all can be okay dependent on how well you are controlled. If it is not controlled, you're doing it more frequently to figure what's going on. If it is well controlled and you barely need any half of a pill, then once a month may be okay.
Thank you, Dr. Fisher. Any more questions?
Hello?
Yes, we are hearing you now. Go ahead.
We know of gestational diabetes type 1 and type 2. Are there any other more types of diabetes?
No, that's it really. They are kind of proxies, and so we will say, oh, dementia is type 3 diabetes, or there are some diabetes that are, let's say, drug induced, and so, but they really come back down to type 2, most of the secondary diabetes. So those are the type 1, type 2, and gestational.
Okay, thank you.
Okay. Well, if there are no more questions, going once, going twice. Thank you so very much, everyone, for attending our webinar today. Christy, thank you so much for sharing your story. And thank you to those persons who asked us questions. And Dr. Fisher, thank you so much for sharing with us today about diabetes and its effect on our health. And we
You're
hope that
welcome.
we have provided you with information to help you with your wellness journey. And as I said, the numbers are in the chat. So if we're not already part of your wellness journey and you would like to join us or to have us join you, please feel free to reach out to us. And then you can also find us on social media, Instagram and Facebook as Bioregeneration. Thank you so much, everybody. Enjoy what's left of lunch and enjoy the rest of the day and the week. And I know, be healthy.
Thank you.
You're welcome.
Thank you. Bye.
Thank you.
You're welcome.